Hello everyone. I'll be starting after some time because we are giving people time to join. Okay. Stay a little bit more. I'll be starting within 5 minutes. My dear beloved candidates, so I'm going to start our today's session. You will not be seeing my face because you will not be seeing my face either until you pass the exam. You only get to see me in grand celebration because I don't look good. That's the reason. Anyway, guys, I look good actually, not that bad. Okay. Anyway, so that's not the fact. Thing is that because I don't have charge. I don't have charge in my laptop. I don't have charge in my this phone too. You can see that it's just 27%. And I have only one charger for my tab and phone because these days they don't provide chargers with phones. So they just give cable. So I lost my cable. Anyway, so this class will be in English because we have international candidates with us, but in every class of topics. In every topics class, we will have two classes. One is in Bangla and one is in English. Both Bangla plus English, two classes. So whichever you prefer, you can watch. If I could provide classes in all languages. In the age of AI, I think we are not so far from doing it, and I'll be able to do that too very soon. Now, first, what I'm going to do, let me tell you what I'm going to talk about today. First, I'm going to show you the question of 2025 September. What's why? Because you have to know that why you need to join our course. Why? Why? There are a lot of reasons, and I will just show you why. And if I could show EMRCS comparison with that or other sheets which you don't need anymore. I'm not going to uh, uh, name those. Everyone uses EMRCS, so I can use that, but I cannot use those names because people can do a lot of things anyway, and some people don't even like me. I know. I don't care about that. Thing is, that I'm going to show you 2025 September questions. The exam happened recently, just a few days back. And the question pattern has drastically changed. Drastically. Now, I will show you the questions. Then I will show you how we do the recalls, how we prepare our notes, and why that's important. For every diet, we have to customize it. For every single diet, why we need to customize our lectures. Now, in relation to these two, how we structured our course and how we will operate, like what will be our groups, all these things. Then I'm going to talk about syllabus of MRCS. Then I'm going to talk about the exam pattern, like either it's MCQ or SBA. What is SBA, and about the fees and all a little bit, because some people really don't know about the fees. And exam patterns means what is SBA, then how they conduct the exam, how they conduct the exam. And if you can't join this class, don't worry about it at all, because you don't need to listen to my boring lecture for long period. You can just take a break and watch it later on when you feel like watching it. In YouTube, I will upload this in YouTube and our group too. So everything, I like to stay organized, and everything is really structured and organized. And there is a reason why I'm going to show you the questions first. There's a reason I will tell you at the end. At the end. Okay. So now, what I'm going to do, let's just show you the question. So you are very exclusive because till now, no one has seen our 2025 September recall. And a lot of people in the world, around the world, they don't even know which question came. And we have already given it to print. Okay. So you can find in various groups, but what's our system? Our system is after the exam, we have a lot of candidates. Like every diet, we have a lot of candidates, and we ask them, give us questions as much as you can remember. So, and what other people's do, they just download it from various groups. So there's a question about authenticity. There's a question about authenticity. That's why I don't trust recalls in the groups I find. That's why I just don't download those and print those. No, I don't do that. I tell my students, candidates, please give me questions. Now, So I don't have Telegram here, but I have Telegram. Give me a moment. Let me show you that I'm telling the truth. So first of all, I would request you that you stay mute. Okay. You stay mute because I really don't like people interrupting me. I really don't like people interrupting me. And that interrupts my flow. But if you have a question, you give that in chat box. I will check those later on and I will answer those. And after the class, I will give you time that if you have any question, you can ask. Okay. So, so you will have your time. So before that, please stay mute. Then I'm just taking some screenshot that how we collect the recalls because I need to, everything needs to, if you see it, you will believe it. So you must see it. That's why I'm just, give me a moment. I'm just taking some screenshot and I will show you those in my other phone. So give me 1 minute because that's important. Okay, I will be not showing you the names because some people feel really uncomfortable because people don't want to let people know that they are giving the exam because just like me, I don't want just two screenshots. Okay, just two screenshots. I will show you from two people that we how do we collect the recalls. Okay. Okay, I'm done. I'm almost done. Let's just stop sharing the screen and then come again. Stay with me. Give me a moment. Like the what do we say? Customer cares. সময় দিয়ে সহযোগিতা করবেন. Just like that. So just stay with me for a moment. I'm just downloading it from my WhatsApp. Save. And I'm showing you. Okay, I'm just showing you from my WhatsApp. Okay. So I'm sharing the screen. If you see anything that you don't like, forget it. Okay. So just from my WhatsApp. See, I'm not showing you the name. Just here are the recalls. Here are the recalls. That's how I collect the recalls. See, don't see the name. So these are the questions I can remember. The exam felt quite tricky and tough for me. I honestly don't know what's waiting on results day. That's how everyone feels. Please keep me in your prayers. Thank you so much. Okay, everyone, like in every course, everyone says they are the best mentor. So I don't mind with it, but I love it anyway. So I love to take classes. And these are the recalls she remembered and she wrote it down for us. And she has been very helpful, very helpful. And we analyzed those and printed those. And this is the guy, he gave me a lot of questions too. So there are some other people. It's in Bangla, like a lot of people. So that's why. Anyway, so okay. So this is how we. Here are the questions: 130, 129, 121. So they gave us 2, 3 options and the clue. What was the question? Okay, and we searched for all those things and made this. Made this. What did we do? We added some other relative questions, other relative options, like 5 options you will have in the exam. We added the answer and we added the explanation. This is the first time we are adding explanation because in previous recalls, we did not add explanation because we explained in class. But for like a lot of people want to take books from us, only books. So we added explanations to in from this recall we'll be adding explanation and pictures also. So it becomes easier. But in our course, you really don't need recalls. Just doing our class will help. So why am I showing the questions? Look at the questions, guys. Probably you are preparing for MRCS first time, so you don't know what were previous questions and why I am saying that this question is tricky, or why everyone says after every exam that questions are tricky. Okay, so you will not have this heading in your exam. We added this. You will just have this scenario, but the scenario will be bigger. The scenario will be bigger, a big stem. Like let's say that here's we wrote that in children. So they will tell you a 10-year-old boy went to field to play football. Anyway, let me just check if I'm audible. Okay. Went to play football. Then he got hit by a boy. That boy was big, and he has a mom who does job. He has a dad who is homeless. So he will have a lot of things, and you have to filter out all those things and come to this part, that what are its active components. Okay, this is just a question, that is, what is the component of a local anesthetic or topical? Okay, in topical anesthetic, what do we use? This is the one line, and you will have 5 options for each question. You will have 5 questions. Of course, you will not have the answer. No, you will not have the answer. Okay, you will have 5 options for each question. 5 options for each question. Each question you will have 5 options. Now you will have, this is a question, this is a exam of SBA. That means single best answer. What's the difference between right answer and best answer? Best answer. What's the difference between that? The difference between that is, in right answer options, all other options will be wrong, and one option will be right only. One option will be right only. But in case of best answer, more than one option can be right. More than one option can be right, or all the answers can be wrong. Not completely, but partially wrong. What do you have to do? You have to choose the best one from all right options, or all wrong options, or all more than one or more right options. You have to choose the best option. And this is the best example for that. Why? Because if you don't have this, you can use this one too. So this one is partially right too. Okay. This one is partially right too. So like, still now this is not used or not invented, but theoretically you can use it. So this one is the best option. Okay, this one is the best option. You have to choose the best option. Now this is a new topic. They asked question, and see how I did. This is from our notes, 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 all from our notes. This is a new question. This is a new question. So this is marked in my note. Okay, while I was preparing this, this is, and I just love this question. I just love this question. And this is another example. Another example. Another example of a best question. Best answer. See, look at this picture, guys, that I have added. Okay. So that's how we prepare our recalls. Let me tell you why I marked new questions, and first give me another example of SBA. So before giving the exam, you must know how this exam operates. That's why you need to see the question first. Okay, it's my job to do everything for you. All you have to do is follow the classes. So see, here we have written which nerve is most commonly injured. Okay, but look at supracondylar humeral fracture. All 3 nerves are injured. All 3, due to various types of fracture. All 3 can be injured. Median, radial, ulnar, all three. And look at the picture. I have given the picture, and this is the picture I use in my book. I used in my book. My book is just filled with pictures because I believe in memory. Remembering is a science. There's no magic. I have posted a video how to remember better, how to study once and you don't forget in your life. So we used all those tricks in our books, routines. How I have explained in that video, I have that in my Facebook channel and YouTube too. I will share the link. You can watch it. So we use all those tricks in our routines, in our books, and everywhere. So that's why we like 52 people passed in last April. 52 people from our course, and some people even don't have that amount of student in their courses in Bangladesh. Okay, so why? Because all three can be injured. Median can be injured, radial can be injured, ulnar can be injured, all three can be injured. They said which nerve is most commonly. And when people were doing my course, I just gave AIN. Okay, and median nerve was not there, only AIN was there. And when you are doing the class, you will be very confused. And this is very normal. And people just bothered me so much. Why this can injure too? This can get injured too. Why did you give AIN? I said, you wait till your exam and you will understand why I gave AIN. And exactly in the exam, they did not give median nerve. They just gave AIN. Why people got confused? They are legitimately confused because AIN in our books, in our textbooks, not our course book, in our textbooks like Vishwaram Singh or Moore's Clinical Anatomy, they have always mentioned the commonest pattern that AIN arises after radial head. So they got legitimately confused that if I have a fracture here, how can AIN get injured most commonly? How? So they have this question. This is a legitimate question. Why they bothered me so much? And some people even got into fight with me in their mind, of course, not in the question group, but in their mind, of course, they didn't like me for that. So but the reference, the what do I say? the the reference books always mentioned that there can be anatomical variations. There can be anatomical variations, and AIN can arise before radial height too, because we just studied these books. That's what we normally do, and that's what I did too. But for this book and this course, I started watching these things, so you get better results in your exam. So that's my job to do these things. You don't have to worry about it. So they didn't believe me that AIN can get injured most commonly. But in the exam, median nerve was not even in options. Okay. So why did we give median nerve? So that you can understand. So if you only take the book, you will not understand that median nerve was not there. You can have only AIN as an option too. That's what we describe in class. So that's why classes are important. And you cannot you will be confused. It's not like you will not pass without classes. You will. A lot of people passes without any course. A lot of people. But you will be very confused, and you will have a lot of stress. Anyway, so all these can be injured, radial can be injured. So this is right too. So most commonly, they didn't mention median nerve. If median nerve was there, this question would be very easy. They just gave AIN because even if AIN did not arise from above, median nerve contains the branches of fibers of AIN. So if median nerve gets injured, AIN will always lose its function. Always lose its function. So AIN would be the best answer. Now, if you did not think this way, what will you think? So median nerve can get injured most commonly, but median nerve is not there, not in the option. And AIN arises from lower area. Okay. So maybe radial nerve will be the best option because radial nerve is near and AIN arises lower and median nerve is not there. Okay. So you will miss this easy question, a very easy question, you will miss it. So this is just one example. And we have 300 questions full of confusions, full of confusions. Guard rotation from our note, all from our note, all from our note, all X-ray findings. You just had the, I will just show you like, do I have drive in this? Let me just see if I have drive in this. Maybe I don't have drive in my tab. Yes, I have. Oh no. Give me, oh no, I can't show my password right now. So, okay. So what's the thing I was talking about? I was talking that this is the exact X-ray picture I have given in my book, in my drive and everywhere, and pharyngeal pouch too. Pharyngeal pouch too. So you got 3 X-rays, and of course, small bowel obstruction. I gave a different picture, but you would understand that this one, like maybe I have it here in my notes, or do I? Let me just check. This one. See, this is the small bowel obstruction picture I used, and pharyngeal pouch and ARDS. Look at the picture. This is the same picture that came in the exams. So let's just go back to our orientation. So these are the questions from last September, which a lot of people don't have, but we have already given it to print. So this is a new question, but I have told the basics in classes. Told the basics is a very easy thing. Don't worry about it. Burn fluid requirement and about Parkland formula, 4 ml. But according to NICE, most of the time they use modified Brook formula, that is 2 ml per kg per percent, less than 20% burn. And in case of more than 20% burn, you can use 4 ml, that is Parkland. Okay. But NICE recommends modified Brook formula. Anyway, so these are the things you must. I have given this Parkland formula because in your exam they can give, this was not written, right? This was not written. I just wrote it down to make it easier for you so you can study. So why did I mark new here? For you, no. For you, no. So we have January examinees, right? We have January examinees. We have January examinees, but January course have started almost 4 months ago. So how would they catch up with these new things? How would they catch up? In my revision classes. Revision classes. So in my revision classes, what will I do? I will discuss these new topics. New topics. So they understand what they need to add before exam. So we have talked about recalls. We have talked about SBA. And we have talked about question pattern. Okay. Number 4, what will we talk about now? How we organized for this changing question pattern and how do we conduct our course? So we have 3 groups for each course. Let me explain. One is class group, one is exam group, one is question posting group. Guys, please stay mute. I'll be muting you. And later on, you will have your time. Okay. Thank you. Now, we have 3 groups for each course. Like for April, we will have April 26, 6. That is 6 months course. We will have a class group, exam group, and question posting group. No text is allowed, no message is allowed in this group. So all the classes stay in line. So whenever you want to do a class, you just go to the group and do the class. In exam group, no text, but all your text comes to question posting group. You ask whatever you want, anything, but don't ask, Bhaiya, what did you have in breakfast? Like this question. So no one does that. Still, I'm just saying it. Just don't. Anyway. So all your questions goes to this group. Any problem you are facing or anything. So I will have a co-mentor who will notify you about the class. Okay. And we will give exam links. You go to the link, click the link, and you give exams. That will be timed exams. For mini exams, 50 marks, 50 minutes. For subject final, 100 marks, some 200 marks. For final mock, 300 marks. Sometimes more than 300, 340, 350, just for your practice. Okay. So timed exams, and remember, you will have to click the link and click submit after you have given the exam. If you don't click submit, we cannot give you a copy. After clicking submit, you will automatically receive a copy of your response. Automatically receive a copy. So that's how our groups are maintained. So I will have a co-mentor. This time we have Dr. Okay, you don't need to know the name, just you will see it. So we will have a co-mentor who will do these things. Okay. And he will respond to all your queries, except he cannot, like some questions or something he cannot describe. I will describe those, and I will be visiting all the groups every day, 24/7. And I will be replying to your messages 24/7. So you will give messages to me or in our question posting group. I will see it always. And if I cannot respond immediately, I will respond within 2-3 hours or after one day, but I will always respond. So these are the groups. Now, this is the groups orientation. Now for the questions, let me talk about the routine. Okay. So the routine, we have divided into topics where we will talk about basics. Basics. Okay. And we will have exams after every topic. In physiology, pathology, after full physiology, pathology, we will have exam from the routine. Now, topics are basics. And what will we do? We will give you, we will take live classes most of the time. And if the basics are just same, we will give a recorded class, but not a problem. It will be covering, it will cover all. Okay, I will take one class live in one language. Either it can be in Bangla, I will mention, or English. And other class will be recorded in Bangla or English. If I take live class in Bangla, I will give recorded in English. If I take live class in English, I will give recorded in Bangla. Just like that. Then first the basics. Now, then we will cover the recalls. We will have recalls discussion classes. In the meantime, January exam will happen. And January exam will have some new topics. So what will you do? We take revision classes. That's how we designed it like this from the first, because I have that in my mind that new questions come every time. We will have revision classes. In revision classes, I will tell you specifically what are important for your April exam what are the new topics they asked, and what do you need to study from those. Okay, and that's the reason I'm marking these are the new questions, these are the new questions. And what about new questions? See, so that's how this is designed, just like January exam, like topics and basics are the same. So all the basics, the classes that cover all the basics, you will have it either live or recorded. Okay, whatever needed live, I will take live. And then revision classes will have all the new topics which they introduced in January. So January is after 2 months. So I do not know what are the new topics. So after the exam, I will have the recalls and I will tell you all the new topics, what you need to study. Now, again, still you will have some new topics in your April exam. What's the percentage? 20, 10 to 20%. You will have 10 to 20% new questions in every single diet. Every single diet. What's the reason? The reason is some international people have leaked one paper back in 2020 or 2021 during the COVID or before the COVID. We know it as a sheet. So all of you knows the name of sheet. Whoever is preparing for MRCS, all of them knows the name of that sheet. And RCS came to know that thing because they have eyes and ears. So what did they do? They just changed the whole question pattern, and every diet they change question pattern because they want to maintain the integrity and acceptance of this exam. And if they kept the question pattern same, people would lose faith over MRCS. And that's already happened. That's already happened, right? And now because of that reason, you don't get a job without a training. I will talk about jobs, don't worry about it. Without a training, you don't have a job. So you need both. You need MRCS and you need training too. So these days, they don't trust IMGs that much without a training because of this incident in 2020 and 2021. You all know the name of that sheet. I don't want to talk about it. So that's named as a sheet too. So what do? They change the question pattern. But people like me, they don't give up. So what did I do? I started seeing all the question patterns. What are the topics they ask? See, here I mentioned the topics. Here I mentioned the topics, which I didn't do previously. Mention the topics. Mention the topics. So if you know the topic, you will see in my classes how I explain everything, and you will fall in love with it. You will fall in love with it. So what will happen? I will explain you the topic. So any question, no matter how twisted and turned the question is, you will always be able to answer it. Always be able to answer it. That's what you see in feedbacks. That's why people love me so much. And only people that don't love me or love my course, they didn't do my course, they didn't see my classes, or they have their own course and people are not going to them. People are not going to them. That's why they don't like me. Otherwise, there's no reason to not love my classes. There's no reason. People love my classes. So you can see it in the feedback. So what will happen? So I will tell you all the topics. So what did I just talk about? That now let me talk about don't get panicked. The people you saw, all of them will pass. All of them will pass. You will see in the result. Okay. Because I know I can feel it. So now 300 questions, right? 300 questions, 20% new questions. That means 10 to 20%, let me say. So 20% of 300 would be 60 new questions. Let's say you marked all of them wrong. How much do you get? 240. So 240. Does anyone get 240? Anyone get 240? Answer is, if 3,000 people give the exam, 3,000 people give the exam in one diet, that's the average number. That's pretty low because it's a costly exam. Only 10 to 20 people gets 240. Majority of them gets around 180 to 200 depending on the question. Depending on the question. That means even if you mark 100 questions wrong, you will pass this exam. You will pass this exam. So what do I focus on? I focus on passing the exam. I don't focus on scoring the highest. I don't need that because scores doesn't matter. If you pass this exam, you are good. They don't even look at the score. If you pass this exam, you are competent to be an international surgeon. You are competent. You have that knowledge. So all you have to do is to pass this exam. So even if you mark 100 questions wrong, 200, that's a lot of number. That's a lot of number. Okay. If you get 200, you will always pass this exam. 200 is a lot of number. So how do they make the question? They give 10 to 20% new question you have never heard in your life. But 80% question, 50% can be very easy. 20 to 30% will be a little bit higher in standard. That makes the difference. 50% are the basics. If your basics are strong, you can answer all of the questions. Total 80% question. And last time, in April, in January, what was this is the cut mark exam. I forgot to tell you. Cut mark exam, not a specific mark that you have to have 75% to pass. No. In January, it was almost 65. In April, almost 65 to 68. This was the percentage of the passing. So that means people passed with 188, 182, these kind of marks. Okay. People passed with these marks. Even, what do I say? Even if the question was very easy still, because you get only 1 minute for one question. You get only 1 minute for one question. And what do? You do the classes very well. You do the classes. I will tell you all the basics you need. You will not understand what are the basics you need to know for this. Some people will think I know everything. Some people will think I know nothing. But for that, you have to wait for the classes. Once you do the class, you will know that, oh my God, I'm seeing very clearly, which I didn't know before. And my job is to prepare your eye. Prepare your eye. So from the complex question, you can see clearly what to focus on and then what to answer within 10 to 20 seconds. And some questions you will not be needing any time to even think. It will be so fast. So that's why you do the classes. Classes are very important, most important. Most important. Classes are most important. You do the class first, and you will be needing only 2 to 3 hours to study after doing the classes. Okay. You have to study like this is the last time you are studying neuroanatomy, and then you will not have any time. And then you give the exam. And when you move on to next topic, just don't think about it at all. Don't think about it at all, because we have made our routine according to theory of spaced repetition, which works best for this. That's a memory trick, works best for every topic. Okay. For anatomy, we have used visualization. For other topics, we have used mnemonics and others and our flashcards in our drive. I will tell you, don't worry about it. I will give you a video. We have in our drive, we will have all the notes, charts, flashcards, and arrows. So first you need only the classes. Okay, if you have taken our book, good. If you have not, you are comfortable with PDF material, you will have that in your drive. We will have all the PDF in our drive. And drive is most updated because we cannot publish book every day, but we can update the drive every day. So if we make any change on in our notes, you will have that in our drive. Okay. So first you do the class. You must do the class. You just take the book and read. No, you will forget everything. So we have used visualization, then spaced repetition for all the topics. We have arranged our routine like that. Like we have, there is a curve by, I forgot the name. Sorry, guys. There is a curve that's called forgetting curve. Forgetting curve. First time when you study, in the first day, you remember everything 100%. So this is the, let's say, first day. After 3 days, you forget 70% of it. Okay. And after 7 days, you almost, it comes down to 0%. This is the forgetting curve. Okay. This is the forgetting curve. Okay. So spaced repetition works like, if you have studied on the day one, we will give you an exam. We will give you an exam link. Okay. So we are hoping that you will be watching and completing the classes within 3 days. Within 3 days. Okay. So these 3 days is covered. You take 3 days for each class. And after 7 days, we will take an exam for anatomy. Okay, because it's a 3 hour class, long class. You will be needing time. So for 3 days, it will be 100%. So when you are almost forgetting 70%, we will give you an exam. So the curve goes up again. So the curve goes up again. Okay, curve goes up again. And you don't forget, and you remember those again. So from 30%, it will jump to almost 70 to 80%. You will remember. Then after covering all the topics, we will take a subject final. That is almost 1 month. Almost 1 month on average. Okay. So after 7 days, it goes down to 0%, which will come back up if you give the exam. So we manipulated this system, forgetting curve, in our routine, so you don't forget. Okay. So that's why you need to follow the routine. But even if you can't, due to some reason, you can always text me about what to do, and I will tell you what to do. That's very normal for, we all have jobs, we all have family, we can have problems. So never hesitate, never hesitate. This is a platform to learn the best. Okay. So what do? You do the class, then you give the exam, and after that, after we have covered all the topics, we will start the recalls. And with every diet recall, you will be revising total syllabus with me. You just watch those classes, 5-6 hours. You just watch those classes. Okay. 5-6 hours, just watch and watch the flashcards. Flashcards. So you remember better. And so day 1, day 3, day 7, day 30. So your forgetting curve remains normal. You don't forget in our course. You don't forget, but you will feel like I'm forgetting, but you will not forget because we have spaced it like that. And in between, we have given flashcards. Watch the flashcards. If we don't have exam on 7th day, watch the flashcards. When will you watch? When you are stuck in traffic, or you are in bathroom, sitting in toilet, without scrolling in Facebook, you watch our flashcards. That will help a lot. That will help a lot. And we have a lot of questions, more questions than EMRCS. So you will not be needing any materials without our notes, classes, and exams. You will not be needing anything because we are updating it like after every diet. Okay. So you will not be needing anything for practice except our classes and exams. Okay, let me show you our materials. We have it here. So what did I talk about? Recalls talked about, and how we customized our course, how structured our groups. And now I will talk about syllabus. I have talked about exam patterns, and we have left with syllabus, fees, and some motivation. Like you don't need motivation. If you are not motivated, you will not be taking this exam. This is a fair exam, but tough exam. Now, I'll be talking about the syllabus. What's the syllabus? A lot of people don't know, and that's very normal. What's the syllabus? Let me tell you what's the syllabus. Like, this is a very big thing. So you don't need that. Let me tell you the summary, because we all have works. We should not waste our time. And that's our goal. I will, if you call it spoon feeding, I don't mind saying it's spoon feeding. We have works. I just give you the tool and you achieve the greatness. You do it yourself. I just prepare these things for you, make it easy. Just like life is stressful, guys. Life is very stressful. So why take extra stress if you can spare some time and spend it for yourself or your family, or you can take a vacation? Why do take all this stress? I'm here to do this for you. So 300 marks is divided into paper 1 and paper 2. In paper 1, we have anatomy, that is surgical anatomy. If you have seen the recalls, you have seen that there is always a clinical scenario attached. Now, that's where you get stuck. Let me show you again. If you see it, you will remember it. That's called visualization. Visualization. See, a child presents with a supracondylar fracture of humerus. Which nerve will be injured? Guys, this is not an orthopedic question. This is not an orthopedic question. This is an anatomy question. So that's how they frame anatomy. This is called surgical anatomy. And they will always attach a clinical scenario, and then they will ask you which nerve will get injured, which artery will get injured. You will have very few. See, they asked about ligament, ankle sprain. Most common ligament injured in ankle sprain, ATFL. Okay, which I only one ligament. I concise it so much. I told people that if you don't need to know about all the ligaments. If they ask you a question about ligament, ankle, they will always ask you about anterior talofibular ligament. If you don't believe me, you ask my candidates. They will tell you that yes, I said that. And in my classes, I'm very specific. I have some classes in YouTube. You can watch. I'm very specific that this one will come and that one comes in your exam. And this is the proof. This is the proof. Not only this one, like I gave a picture of Shuborno Isaac Bari, like Shuborno Isaac Bari for this one. What did I tell people? That see, question can be tricky, but always remember that BO1E, 1, collagen type 1. So in bone, you will have collagen type 1. So even if I didn't tell people this, even if I didn't tell people about this particular question, they are seeing that multiple fractures, so it's related to bone. What will be the diagnosis? And bone have collagen 1. No one in my course made it marked it wrong. No one. Everyone marked it right, because collagen type 1, you will never forget. I told you that BO1E, bone. So collagen type 1 disorder, osteogenesis imperfecta. Anyway, so you will have everything. Like you will love this when you start studying. So surgical anatomy, then we have physiology, then we have pathology, microbiology, then we have some extra topic, biostatistics, which is not important at all. You will have only few questions, 2 3 questions, and everyone knows what are these 2 3 questions. Everyone, every coaching owner, every mentor knows what are these 2 3 questions, and they will tell you, and you will have always mark these questions right. Then we have pharmacology and some investigation related questions which are embedded in our notes. Don't worry about it. So now what will be the marking? Almost 70% questions comes from anatomy. 65 to 70% questions comes from anatomy. Physiology, pathology will have 20% questions and others will have 10% questions. That's approximately 90% questions from these three. Now, they mix and match. Sometimes they give 60% from anatomy, 30% from physiology, like this. Okay. Previously, people said for paper one, you only need anatomy, anatomy, anatomy. But I always said no, without physiology and pathology, you will not be able to pass this exam. And these things happened in last 2 3 diets. 2023, the diet I gave the exam, 24, all 3 diets, and 25, still now, all 2 diets. People have failed due to physiology. People have failed due to physiology, and they scored really well in anatomy. So do not neglect physiology and pathology. Do my classes. Do my classes. So do not neglect that. But if you neglect others, I will not let you neglect others. I have specific just one chart for microbiology and arrows for pharmacology and biostat. So only 10% questions come, and you will have almost 8% from my notes direct. Direct. So it's tough to remember because people are not regular. There are reasons for that. I will try my best so you can remember. So these are direct questions you will have from my notes, from my arrows. Direct questions you will have it. And of course, from final suggestion. Of course, from final suggestion, you will have some direct questions. So if you don't, even if you mark all 10% wrong and you do very good in anatomy and physiology, you will pass this exam. So from our analysis, 90% question will come from anatomy, physiology, pathology, and only 10% come from microbiology, that is 6 to 7 questions, physiology, pharmacology, that is 6 to 7 questions, and biostat 1 2 or 3 questions mostly. So from 7 questions you will have from my notes direct question from physiology 2. Now I'm just stay with me. So let's say 5 direct questions, 5 direct questions, you will have it, you will have it definitely, and all 2 3. So if you don't study these at all, just study my arrows, you will mark almost 12 questions right from here. Okay. And anatomy, physiology, pathology. Of course, from arrows and other shortcuts, you will have almost 50% question from there, and other 50% from the basics I tell you. From the basics I tell you in class, you will have all those 50% question. So most of your time you should give in these 3 topics. Most of your time for paper one. For paper one, that have 180 marks in total. Okay, 180 marks in total, and 90% question will come from anatomy, physiology, and pathology. Okay, and you will have all of those from our course. So do the classes, otherwise you will miss this 50%. From arrows and shortcuts you will have 50%, but other 50% is from the basics I tell you, and from paper 2. In paper 2, we have 120 marks coming from emergency, trauma, peri-operative care. Almost 70% question comes from here. And then comes the surgical topics. I'm very specific, so it's easy for you. From all surgical topics, abdominal surgery, colorectal surgery, breast surgery, vascular surgery, pediatric surgery, head neck surgery, skin and others, and brain surgery. All of these topics will have only 30% mark. That means from each surgery topics, you will have only six, six, six questions. Okay, that looks like a lot of questions, but only sometimes they just give 2, 3 questions from other surgeries, and one topic they give a lot. From one topic they give a lot. Sometimes vascular surgery, most of the time vascular surgery, they give a lot of questions. Sometimes urology, sometimes breast surgery, they give 10 questions, and from other surgeries 2 questions, 3 questions, like that, okay. But orthopedics is consistent, they always give 5 to 6 questions from orthopedics. So if you give a lot of time to these topics, what do you miss? Only 3 topics. Let's say these 3 topics is 30 page, and all these topics, one topic is 10 page. 1, 2, 3, 4, 5, 6, 7, 8. Let's say all these topics are 500 page. So from 500 page, you are having only 30% mark. And from 30 page on my notes, you will have 70% mark. So you know where to give the time. Okay. So for paper 2, most of the time should be given for emergency, trauma, and perioperative. Most of the time. And most of the time you should give in emergency, trauma, and perioperative. And people fail almost. Again, I have to repeat this line, that anatomy. No, guys. Last April and even last January, people got all questions from my final suggestion in anatomy, physiology, and after they gave the exam, those who did not do the classes because it was short and they felt like they need to study more, they forgot a lot of things what I said in class. They forgot a lot of things and marked a lot of things wrong, and they were regretting so much. I wish I could show you the screenshots, but due to confidentiality I cannot reveal their name. But they have told me over phone, due to confidentiality I cannot reveal their names. But you could have asked them directly that what do you regret, they would have told you that I regret not doing the classes, because they remembered it little that I told those in classes, but they forgot it because they loaded them with unnecessary informations, and they marked the known things wrong. Because this is very important. Your brain will always forget. Human brain is limited. Your brain will always forget. If you input a lot of things, they will not know which ones are important. They will not know. Your brain doesn't know. Your brain is lazy, like me. I'm lazy. I don't like exaggerating things. So 70% of your time should go to emergency, trauma, and perioperative, and what I say in class. What I say in class is very important. Very important. You will have questions from direct questions from there. And I will tell you specifically what will be the questions in your exam. Now, people fail due to trauma. People fail due to trauma because a lot of questions comes from trauma. And when I describe the basics in class and new topics in revision classes, like everything is included in my note, everything according to nice guidelines included in my notes. And this time I have included in my recalls reference to, because people tell you that from Bailey and Lab we have included this, we have did this, bro. Bro, calm down. I did this a long time ago. So don't worry about it. Everything is included from the best source possible and latest source possible. Okay. And follow what I say in class. Follow. Now, what was I telling about trauma and paper 2? Class is the first thing you have to do. So from paper 1, to summarize, anatomy, physiology, pathology, you give most of your time. From paper 2, emergency, perioperative, and trauma, you give most of the time from my class and notes. So you will pass this exam. You will pass this exam if you focus on only these 6 topics. Why? Because from 30 to 40 page, you are getting 60 to 70% of the mark. And from 200 page, you are getting only 30% mark. So which one is more profitable? So let's say you have 2 jobs. One job is paying you 1 lakh. That is a dream, by the way, in Bangladesh, no jobs. And it takes only 2 hours of work. And one job is paying you 1 lakh 2, or let's say 30%, 30,000. 30,000, and it will take 8 hours a day. Which one you will choose? Simple, of course, 2 hours and 1 lakh. That's more in return. So that's the same thing about emergency trauma perioperative. It will give you 1 lakh in just 2 hours in comparison to surgical topics. So this is a basic exam. Don't get obsessed with surgical topics. Don't. You will make a big mistake. And focus on emergency trauma perioperative from our classes. So if you want to read it full, I will give you, I will share this PDF. You can read it again. But I will recommend you don't waste your time, because they have mentioned that they will give you at least 1 question from thorax perineum, at least 6 questions from brain, at least 10 questions from head neck, at least 6 questions from thorax here, abdomen 15. But they don't really follow this rule. If you see the recall, you will feel like they have given all questions from abdomen and no question from thorax. But that's not true. They mix and match. So I tell you about percentage. Almost 70% question will come from anatomy in general. So anatomy, physiology is very important, guys. Very important. And you will love our physiology classes. And here is applied surgical physiology too. So you will not get what is the cell membrane type, lipoprotein. No, they will not ask you these questions. I will tell you in class what will be the questions. So don't worry about it. I will tell you every single thing that we will be needing in your exam. Now, let me show you. So here is the detailed question pattern. They will tell you that here you can OSCE, you don't need it right now, just pass the first part, guys. And another thing, my job is not to motivate you to give this exam. Like why, like some people say, if we don't get a job in UK with this exam, why will you give? That's totally your choice. That's totally your choice. This is an international exam, and it prepares your eyes so beautifully. You become a beautiful surgeon. Aesthetic, guys. After you give the exam, you will see the difference. You will see the difference, and you will be very clear about your diagnosis. That's why. That's why I chose this exam, because this has and international recognition. I just don't want to confine myself within a boundary. If I had time, I would give all the exams in this world about surgeries. But I'm a lazy person and I have a lot of things to do, so I cannot do that. So about jobs and others, that's a different discussion. If you want that discussion, uh, I will upload a video about, because I'm starting a podcast about jobs and others, and I will talk about those. I will tell you. Now, here is our books. In during admission, you will get these 2 books. Crack MRCS Part A, I am updating because it is a 3rd edition right now, and I am updating the 4th edition. due to recent changes. Okay. And if you don't have the fourth edition, don't worry, you will have it in Drive. And in my classes, I will tell you that add this, because editing a book takes time. It might not be prepared totally. It might take 1 more month to edit it. So don't worry about it. You will have it in Drive. And in my classes, I will tell you add this, because this has been changed. And we have kept places in our book so you can take notes during classes. Classes will be big, 2-3 hours for anatomy, 1 hour for physiology, 2-3 hours for emergency trauma perioperative. So I recommend not to watch it in one go, because you will lose concentration. Watch 1 hour, take a break, see some notes, see some Instagram reels, refresh your mind. Then when you feel like again, come back and watch 1 hour again. But in that 1 hour, forget every single thing in your life. Don't think about anything. We all have problems. We have jobs problems. We have family problems. We have kids. We have a lot of things in our life going on. Just give that 1 hour totally. And through our method, in every way, in our book, we have used, I will show you some pages, don't worry. So you give that 1 hour totally, then you take a break, do whatever you want. Don't think about studies at all, because that will cover all. You don't have to read anything extra to pass this exam except what I say in class. So focus on that totally. Now, so you watch 1 hour, take a break, then 1 hour again. That's how you finish the class. Okay. But if you don't watch the class, the topic, if you want to study only from the book, it will take 6 to 7 hours a day for 2-3 days, and you will not remember a shit. So you will be very upset with yourself. But if you watch the class, it will take only 2 to 3 hours to cover the entire topic with all the important things. Okay. So watch the class first. Watch the class first. So you will receive 2 books. Why? Because we update the recalls, because while you are doing the classes, January exam will happen. So we will add January recalls and then send you the recalls book after January exam, like we are sending the recalls book for January exam is now, because September exam has just happened on 16th September, and 17, 18, 19, 20, 21, 22, 24. 23. Within 7 days, we prepared a book. See how much dedicated we are for our candidates. We prepared a book, not just a PDF. We prepared our book and we deliver it worldwide. Be you can be in Canada, you can be in Africa, you can be in Canada. And last April diet, we gave one delivery in Libya. So we deliver all around the world. So don't worry about it. So we are giving our book all over the world. And we have a trade license. Don't worry about it. We have a trade license. Don't worry. So these 2 books are enough. You will not be needing anything. So let me show you some of my notes or books, PDF, which I'm going to use. So recalls book, no. So let me show you just urology, abdomen, colorectal, or what? What is this? Recalls. Let me show you how we prepared our books. Yeah, this is a recall. This is a recall for September 2024. Emergency perioperative. Okay, anatomy. Let me show you our notes, guys. So your books will be like this. These are the pages, and you have it in our drive. Don't worry about it. These are the pages, and these are full of colors. Why? So your brain don't get bored. Your brain don't get bored. Why full of colors? Why full of colors? So your brain responds to colors better. Your brain responds to colors better. And we have scientifically mapped out everything, because You will not remember simple lines. You will be forgetting it easily, but this color will be harder to forget for your brain. And your brain must pay attention to these colors, because in the age of digitalization with so many beautiful images in Instagram, your books will feel boring and your brain will feel like sleeping. So your brain will not get sleepy when you see the colors in your books. We have put a lot of effort in these books, guys. Now this is the first paper, so you don't get, your brain doesn't get bored. You might get bored still because of heavy workload, but your brain will always respond to color better. And we just didn't select random colors. Just like Coco Melon cartoon. What did Coco Melon cartoon do? If you have a child, you know that there is a cartoon called Coco Melon. They got sued because they conducted a study which colors interact with your brain more, so you get addicted to the cartoon. So if your child gets addicted to a cartoon that is Coco Melon, that is very widely viewed by children these days, like 2 3 years, boys and girls, they don't eat without watching Coco Melon. That's so much addictive. That's your subconscious mind responding to colors. And I wrote that study, unfortunately or fortunately, and I saw that if child brain respond to these colors better, why not I include it in my book, so adult brain can correlate too, because inside we are all child. So I just made an experiment with these colors, and that worked. That worked. Now I'm going to show you. That's why we used colors, and we used color coding. How we used color coding? Let me show you how we used color coding. What is color coding actually? This is microbiology, and no, not in microbiology. Okay, I can see you this one. I can show you this one. No, not in this. This will not be easier for you. Paper two, where is my paper two? Give me a minute, guys. Give me a minute. I will not take much time of yours. So just some more, just some more time. Okay. I'll be finishing soon. I will giving you time for questions. Just some more time. This is important. So you know what you are actually, why and how you are in our course. Okay. So this is important. So this is our physiology and pathology book. So everything, so you can relate. No, so let me make it easier for you so you can relate. If you can't relate, your brain will forget. So okay, this is a method I have used, that is association. So you can remember, like, from when I started, it was only Bangladeshi candidates. So use this guy, Zayed Khan, to associate. So you never forget what is a synergic graft, allograft, and these are the memory methods. If you replace a pig heart to a human, that will be a xenograft. So this is called association, which we used as a memory trick. So you can remember easily. And color coding, here we can show you color coding in our paper too. This is very boring, so we made it interesting for your brain. Even if you don't feel it now, you will feel it in the exam. Here, no, like, give me a moment. Here's the Gleason score, Gleason pattern, which uh, I describe in classes, and you have seen specifically this score. I have written it down. See, 100%, and it came in exam in my last class. See, oh, this is color coding. This is another color coding method. This is the first one. See, you know it. Like blue, this is low. So even if you forget that this is low, you remember the color that it was blue. Your subconscious mind will always remember the color. So this is low. Yellow, that is intermediate risk. Red, dark red, that is very high risk. So red is a very high risk. We all know from our childhood. And this is color coding. This is color coding. We have used this for every disease. Every disease we have used this. How we use this? Let me show you again. See, we have used this coding everywhere. Everywhere. Just like cocoa melon, but in a good way. I don't make you addicted to bad things. Okay. So just in a good way. See, this is no, not this one. You will not understand. You will understand it during the classes. I will tell you. See, here is almost good, good. So this is green, good, but not good. This is red, always a bad condition. So that's how we used it. There are no random colors in my book. There are no random things in my book. See, let me tell you one thing. Let me tell you one thing here too. This is color coding we have used. See, we have given it yellow, we have given it red, so you can relate radiotherapies. Though it's not related, still it will help. And these are not so important. And hormone replacement therapy, HRT, we have given it green. Why? Because there is a question that if a person is, number one reason, that is if a person is positive, ERPR positive, that's a good prognosis. Good prognosis. We have that later on. We have written it down. We have written it down. That's a sign of good prognosis. Even here we have not written it, but we have colored it in green. Every time we have mentioned this, every time we have mentioned hormone replacement therapy, we have colored it green. So you remember that this is green. So this is the good prognosis always. So every color in my book, I have done it this way. Okay. So here too, non-modifiable. This is red because this is non-modifiable. If you have that problem, this is non-modifiable, but this is modifiable. So this is green. So that's how we used. Let me just tell you that in case of the disease that causes bleeding, we have colored it red everywhere throughout all my book. If there's 2 3 disease that's cause bleeding and that's in a serial, we have colored less bleeding, that causes less bleeding, that's pink. That causes intermediate or medium type of bleeding, we have colored it bright red. And anal fissure, we have colored it bright red because in anal fissure you get bright red bleeding. And the disease that gives you dark red bleeding or more bleeding, we have colored it dark red. So with only the words, there are not so words. So here you will be seeing it. It's according to its breast. Okay, colorectal surgery, we have it. Here we have it. See, see, this you will be understanding it better. See, brownish discharge, that's why we colored it brown. Okay, like that. See, anal fissure. See, we ran out of colors. We ran out of colors. So this is, I had terminated bright red because this is bright red bleeding. And ulcerative colitis causes bleeding. So here, in comparison, this is dark red bleeding. Diverticulitis will cause darker bleeding, but we could not make it more dark. So I tell you in class. So that's how I have used color coding in my classes I will tell you in details that how like even if you don't know, your brain will remember it. Okay, that's how I have manipulated my notes so it's easier to remember. So now I have almost talked about everything. These are the notes and these are the routines. These are the routines which I have told you. Let me just show you once. Let me just show you once that this is not your routine. Okay, this is the same thing that's happening. So you will have the topics first. Exam after every anatomy, physiology after full physiology, because there are not much question from each topic because I have elaborated so much topics. So these just 2-3 questions from each topic. We cannot make a question with 2-3 questions. That's why pathology too also, pathology after, but emergency, trauma, perioperative, orthopedic, and this time we will give you a trauma class separate, not in the notes but during revision, because I feel like that trauma needs a separate class, so I will add that later on. Okay, so then all the surgery topics you will have exams after all of these are less important, but these three are most important. These two classes, these 2-3 classes, if I add a class, and then we will have recalls discussion, and then we will have rapid revision and mocks. I will divide paper 2 into 3 groups and take classes on these 3. Then full paper 2, then physiology, pathology, microbiology, biostatistics, then class exam on that, then anatomy in 2 parts, then exam on that, then final mock, then final suggestion, and again one paper, one final exam. So you will not, you will feel like, because a lot of thing you have to study, you will feel like you are forgetting, but you will not forget. Just trust me what I'm saying. So that's how we have arranged it. Then we will have 3 groups. We will have 3 groups. Like for your April exam, you will have April. It was you will have April exams, April class, no text in these groups, no permissions, nothing, and you will have question posting. See, in September we had, like after that it was just a orientation of January, and we already had 62 people. And September 2 we will have, after that we have opened 2 courses again, so 115. So in every diet we have almost 150 to 200 people. So due to special BCS we had less people in this September exam, less people gave MRCS. So, okay, in MRCM these are other courses. This question posting group, you will have all the questions, any confusions, any questions, any requirements, and I just take classes. Remember, I just take classes. We have technical team. Shafi, he will be handling all your drive problems, or sometimes your some people have poor internet connection and class don't play. We upload those in drive. Don't worry, we have uh, prepared for every difficulties. Don't worry about it. So you will have him as admin in our group, and you can text him anytime for any problem. That's the tech guy, will handle technological issues, and our co-mentor will handle all your day-to-day queries. And I will just be, and our, this is about our group, I will be just taking classes. And your payments and others, or installments or anything, I don't deal with those things. We have a communication chief for that, that is Dr. Joby, and she will help you with all the communication in our WhatsApp number. And feel free to contact anytime, anyone. Okay, and I will take classes. And then everything has been described. Then about our drive. In our drive, crack MRCS part A, you will have arrows, charts, flashcards, and paper 1 and paper 2 are notes. Power shorts are short videos. Short videos and short videos. This time, like recently, we are uploading those in YouTube. You can watch it in YouTube too. And some short videos are only here in our Power Shorts folder. So topics like hyperparathyroidism, long class, and hyperparathyroidism is a frequent topic. So we made a 5-minute video about it. You can just watch it whenever you feel like revising it. That's it. And then recalls. We will have all of those in our drive, but you cannot download it, because if you can download it, we all know that you love your friends and you will share it with your friends and everyone for free. And we have to stop our courses because we cannot bear the expenses. We cannot pay Dr. Jobby. We cannot pay our co-mentor. We cannot pay Zoom for classes and our exam software. So we have to shut down our coaching. So we cannot let you download those. So these are the chapters. You will have PDF form of the chapters, head, neck, neuroanatomy, all of those, thorax and pathology, biostatistics, microbiology, you will have it all. In physiology folder, you will have it all. So this is very organized. If you don't take books, you will be able to study it from your tab or iPad. Okay. And here's the chart folder. All the important charts are here. Aneurysm size, then bacteria virus chart. You will have questions from this chart. All microbiology questions from only this chart. Then biopsy, other charts. Then flashcards, just to watch when you are in washroom or bathroom or traffic. Abdomen dermatome, abdominal incision types, absent, ganglion, then Froment's test, all these things. So for a quick revision, so you don't forget. So that's how our class and discussion ends. These are the feedbacks. Beautiful bed sheet. I like this. I have it a bed sheet too, and I sometimes tell people to send me pictures when you receive the books, because sometimes books are not in good condition, and anytime you face this problem, we immediately replace your book. Don't worry about it. If delivery man destroys our book, so remember one thing, guys. Last thing I'm going to talk about, and I'll be giving you time. So this is a circle. This is a circle. This is a circle. Why I'm drawing this circle? See, only 5% of the people are inside the circle. They are the most powerful ones in the world. Like the top businessmen, the top politicians, the top influencers, and they earn 90% of the world's wealth. Okay. And at the periphery, these are the circles. These are the circles. At the periphery, the average people, and they lead average life. Okay. What's the difference? They have 90% of the world's resources and everything. Just like that, in every profession, there are circles, orbits. At the center are the top performers. Top performers. Only 5% people. And from 100%, 80% are here, 15% are here. That's from a 10% are here, 5% are here, and 5% are here. So in one generation, going from this orbit and this to this orbit is very tough. Very tough. In every profession, we have average people, we have moderate people, and these top performing people. Now, most of us are average, including me. I'm below average, and I don't mind admitting that. And that's pushing me to go further. That's pushing me to go further, because no matter which orbit you are in, no matter which orbit you are in, if there's an elevator or a shortcut, if you have the drive in it, you just take the elevator and you can go there. You can go there. This is very much possible to be the 5% who gets it all, and that life is good. That life is good. I dream about that, and I want to go there too. That's why I want to achieve an international recognition with my work. So that's why I gave MRCS. That's a gate. It may be tough. It may be tough, but I will do it. So that's why I choose. And if you have a reason, you can always give this exam. Jobs are secondary. You will always have jobs. Now, if you have any question, I'm please mention about the fees. Okay. Oh, sorry, I forgot about the fees of this exam. Okay, I'm writing it down. So fees of the exam. Fees of the exam is increasing day by day. Guys, and pound rates are increasing day by day. It's 625 pounds. And in Bangladeshi Taka, it's almost with the VATs and charges, it almost costs, depending on the bank to bank, almost costs 110 to 125K. That means 1,25,000 Bangladeshi Taka. In case of Indian rupee, it's lower, 80 to 90, depending on the pound rates. In case of Pakistani rupee, guys, this is just so much. Most of my candidates are Bangladeshi, Indian, and Pakistani. So I just talk about these two, but I have candidates from Turkey, I have candidates from UAE, and Bangladeshi people from UAE, UK too. So from about Turkey, about UAE, it's lower. About Egypt, it's lower because their dollar pound rates are lower. But for Bangladeshi, Indian, and Pakistani, it's quite a lot. And for Pakistani, it's the most, almost 3 to 4 lakhs Pakistani rupee, PKR. About Sri Lanka, oh my God, this is almost 2 to 3 lakhs too. So this is a costly exam, guys. This is a very costly exam. So you have to be very careful. You have to be very careful. If you think that you will take, not take this course, not a problem at all, but that will be high risk. A lot of people passes without courses, but these days it has become tough because the resources you have, the Fauziya sheets, the EMRCS, those are just because of those sheets, the exam pattern has changed. So you will not have much question from there. Some question will always touch the basic from there. See, 160 to 170 questions, it's just some questions with basics, you know it. So just some questions, let me show you. I have that too. Let me show you. See, I have all the versions. These are just my recall. So one resource like that, just some recalls with, see, Valsalva maneuver. These days they don't even give this question. Look at my recalls recently. They don't even give these questions these days. So see these things, just some questions, and these will not prepare your basics, and these questions doesn't come anymore. Okay, it's just some recalls questions. So I am not saying these will not help, but these are not so helpful. See, only from this chart. So my one recall contains all of the things which you have in these sheets. Only one recall, and I have last 5 years recall made like this. So I'm giving you 5 times on this because see, only by studying this chart do you really think the question that came in this year you could answer? No, because you always have 2 to 3 questions in your, like from thyroid carcinoma from this chart. No, you will need more basics. If they turn and twist this question, if they don't give this scenario, what will you do? You will not understand only from this chart. And it's hard to remember. Remembering only from charts is very hard if you don't know the context. So this really doesn't help. I know what are in these things, so I have included all the important things in a better way. So I have this all because for you have to have an eye to everything if those really work, right? And then, so that's how everything I have explained almost. So if you have any question, you can ask. Can you please mention the name of countries that accept MRCS? That's a different discussion. A lot of countries accept, guys, we have ChatGPT these days. A lot of countries that is, but see, this is a recognition. Let me write it down. You will understand it better. Where is it? Where is it? Okay, orientation. Let me go back to orientation. Okay, what are the countries that accept MRCS? See. Now the question is either it's for job, or of course it's for job or training. For training. So let me first come to Malaysia and Singapore. Why first? Because in their system, after passing MBBS to get into a residency, first you have to pass MRCS. Okay. So if you want to get into a residency, you have to pass MRCS to work in Malaysia. If you want to work as a surgeon, if you don't want to work as a surgeon, that's a very different discussion and it will take a lot of time. If you don't want to work as a surgeon, you want to work as a GP, you will not be needing MRCS. See, they not only just accept in their curriculum for getting an R1 residency, you have to pass MRCS first. Either you are in Singapore or their citizen or outside citizen. Now, there's a catch. These days, Bangladeshi people has made so much bad reputation. They so much bad reputation because of Neil Khet and other things. People have done these things, guys. People have done these things. So if you are from UK and you have passed MRCS, you will just get into by applying. So for Bangladeshis, if you have an MRCS, you have to get in two ways. Number one, you contact their hospitals. If you have some acquaintance, if you know some people, and you get a letter for job. So you don't need licensing exam. You contact your hospital, you contact a hospital, you tell them that I have an MRCS, I want to do a job. If they give you a letter, and they do, a lot of hospitals do. If they give you a letter, you can apply for their visa and they will give you a provisional registration. So you will have to work 1 year, almost 1 year, sometimes 6 months under supervision, and they will see if you are good. After that, you will get a registration without any licensing exam. And if you have an MRCS from outside, there's another way is you give the licensing exam. After giving licensing exam, you can get into their residency with your MRCS. Then comes Middle East. Qatar, guys, it's a dream country. Dubai, UAE, Sharjah, Ajman, or even Saudi Arabia. If you are from UK, you have an MRCS, you can just directly get a job there. But if you are from Bangladesh, there is a problem. The problem is they don't trust Bangladeshis. So what do you have to do? You have to give the licensing exam. You give the licensing exam, and then if you want to work as a surgeon, you must hold minimum MRCS, or you want to get into their residency, you must hold MRCS. And with MRCS and 2-year training in our country, they accept it. You can work as a consultant there and you can do minor operations. Okay. You can get into their residency and you can get a job there. Like I have candidates from UAE who are working as a GP there and they gave MRCS, because MRCS, with MRCS, you get their residency, surgical residency, and their surgical jobs you get through MRCS. So that's about Middle East. Okay. Then, so that means they don't just accept it. This is a qualification you need to have if you want to work as a surgeon. Why am I talking about MRCS? Because this is the lowest of cost. About AMC, USMLE, it takes a lot of time and it costs double and triple for MRCS. So this is the easiest route. Easiest route. Then about UK, If you talk about UK jobs, yes, there are some recent concerns that people are saying that you are not getting jobs. But in comparison to current condition in Bangladesh, if you compare it, or in Pakistan, two ways. Let's say you want to go to UK, and UK, the job condition is 100 times better than Bangladesh. How much do you get as a junior surgeon? Maximum 50,000 after MRCS part, after FCPS part on training, maximum. And is it easy to get a job in Bangladesh if you don't have connections? No. Is it easy to get a job in UK these days? No. But aren't people getting jobs? Yes, people are getting jobs. Like, like I have met people that has got jobs recently. Even if it's tougher these days to get a job in UK, but the situation is better than Bangladesh. If you want to go to UK, if you don't want to go to UK, you have other options too. Like almost 170 countries in this world, and except United Kingdom, United States, sorry guys, United States, you have to have their own residency. I'm not talking about India, Pakistan. If you have an MRCS, even if in Bangladesh and some training, you get good jobs, like good jobs in various places. I'm not going to mention it. It's a very big discussion. United States, Australia, even if in Australia, after 2-3 years of job experience after MRCS, you can get a job in New Zealand and Australia. So this is relative. This is relative. It's about you. Okay, so about job, this is not a class about job. It's about the question. But I will make videos about job situation because a lot of people are asking about jobs. And some people even accuse me, I don't talk about jobs because that's not my job. And I don't focus on uh, these things much. Anyway, any other questions? Or if you have uh, any other questions about jobs, you can ask. I'm unmuting you guys. Okay. Any other question, Nusrat Takia? Are you satisfied with the answer or you need to know more?
Yes, yeah, it's okay. I understand.
Okay, no problem. Then, any other question? Anyone? Okay, guys, then thanks a lot for your patience after 2 hours. Guys, I'm impressed. Like 2 hours you were listening to me. I'm very impressed. Thanks a lot for being with me. Thank you, Doctor. All of the people. Thank you, Dr. Ria Moiti. Thank you, Dr. Email from Turkey. Ria Moiti from India, maybe. How are you, Dr. Ria? Hello. Okay. Okay. Don't worry. Dr. Tanvir, how are you? Dr. Asad, anyone? Okay, guys, maybe you slept due to my lecture. Don't worry about it. Have a good night, guys. I will upload the class. It might take some time. Don't worry about it. You can rewatch it later on. Thank you for being with me.